Good morning to everyone, and welcome to our session on the topic of cervical cancer and the role of the cervical cancer vaccine. We are pleased to have Dr. Seema Theraja among us to educate us on this topic. The doctor has taken part in several cervical cancer awareness related campaigns and is an expert on cervical cancer prevention, diagnosis, and treatment methods. So the doctor is the best person to keep us informed about this topic. Doctor, you have the stage.
Thank you. Hi, as already introduced, I'm Dr. Seema Theraja, Senior Consultant at Apollo Cradle Hospital, Moti Nagar, Delhi. So today's topic is cervical cancer and role of cervical vaccine in prevention of cervical cancer. Now, unfortunately, in India, cervical cancer is in India. Almost close to 1 lakh women are infected with cervical cancer in India. And if untreated, it is fatal. As you all know, most of the cancers, if left untreated or undetected, they cause mortality. Now, cancer cervix, as you know, is the cancer of cervix or the mouth of uterus. The commonest cause of cervical cancer is a virus called a human papilloma virus or an HPV infection, which you must have commonly heard of this term. Now, human papilloma virus, I'll just tell you in short about this virus. It's a DNA virus and it is of various subtypes, like almost 100 types of HPV virus exist. It is not that all the 100 varieties are cancerous. There are few varieties like 16, 18, and other varieties which can cause cancer. So one has to be clear that just having an HPV infection, you don't need to worry that all HPV infections will lead to cancer. It is just few subtypes or genotypes which can lead to cervical cancer. Now, all alone, HPV virus is one of the essential reasons of having a cancer, but it does coexist with other coexisting factors which can lead to the cancer developing. So, women who first of all, the cancer cervix is always present in sexually active women. So, patients with multiple sexual partners, patients with chronic cervical infection, patients with multiple births, patients with poor socioeconomic status, lack of hygiene, prolonged use of contraceptives, smoking, all these factors add on to your risk of developing cancer along with an HPV infection. It's not that all the HPV infections lead to cancer, as I mentioned earlier. It's only 1% of them progress to cancer stage or an invasive cancer stage. So that is one fortunate part that we do, and the progression from infection to an invasive cancer is long. Like it can take 10 years, it can take 15 years. So that is one good aspect of it, that if we catch the HPV infection in the early years and the patient is treated and patient is in regular follow-up, such patients may not progress to a progressive or an invasive cancer stage. The common symptoms of presentation of cervical cancer is patients usually present with abnormal vaginal bleeding. Common complaint is postcoital bleeding, bleeding after intercourse, having a chronic, unhealthy, foul-smelling discharge, and if the cancer is widespread, then you may have other complaints. So if it is spread onto your bladder, if spread onto your rectum, then you'll have bladder and bowel complaints. So these are complaints when the cancer is quite evident. In developed countries, they always pick up the cancer in a pre-cancerous stage by routine Pap smear. Now, I'll just talk about, in short, about Pap smear. As I said, cervical cancer is the cancer of the mouth, which is easily accessible. One can easily see this cervix at every visit to the gynecologist. So it is much easier to detect and prevent and treat this cancer. So, how do we detect this cancer? The commonest test for this is Pap smear, which you all must have heard commonly. It is quite present in most of the routine health checkups of women package. Pap smear is a smear which is taken from the mouth of the cervix. In this, the women visits the gynecologist. A routine examination is done by a speculum examination. The gynecologist visualizes the cervix, and with a special stick or a pap smear, this thing, we take the smear from the mouth of the cervix, and then it is put in a medium and sent to the lab in which they study the histopathology. So it's a very simple test, easily accessible, and painless, and it can be done on anyone and everyone. Usually, as I said, it is done in sexually active women. So in India, the average age where we start doing the pap smear is around 24, 25, or even up to 20. And the pap smear can be done from 20 to the age of 65 years. Now, as per the recommendation, ideally, if the resource setting is good, like in big metros or in big hospitals, you should ideally do a pap smear along with an HPV testing. In the same smear, both the things can be done. Now, if you have good resources, ideally this should be done. And this is recommended that every 5 years, the women, if she's getting a HPV with a pap smear done, it should be done every 5 years. Now, in the resorts where there are not too, like in tier 2, tier 1 cities or small setups where the resources for HPV are not available, then a routine pap smear also can be done, which is equally, it's quite effective. In a country like India, we have a massive population, so it is not possible to screen everyone with HPV and pap smear. So we can do a routine pap smear, and routine pap smear is recommended every 3 years in a lady. And in places in small primary health centers or very small centers where there is absolutely no facility, then the government says that we can just apply acetic acid on the cervix, and if there are any suspicious white areas, such a patient should be referred to a higher center for further evaluation. And then there are various evaluating methods, which once the patient reaches a bigger center, it can be evaluated further. So the good part about cervical cancer is that it can be detected by the simple pap smear test. Takes a lot of time from progressing to a early detection stage to a invasive cancer stage. So if patients are picked up at this stage, it is a pretty treatable cancer. So then the prognosis is good. The key is to pick up the patients early. So all women should be aware that they should be getting a pap smear done, whether with HPV or without a HPV. At least once in 3 years, a pap smear should be done, and it should be a part of the standard protocol of all women health checkup, so that no patient is missed. In most of the developed countries, cervical cancer is very low because pap smear is done as a routine, and they are able to pick up the patients in early stage. That is when the virus is still in the early epithelium, which we call it as carcinoma in situ. Such patients will, only 1% will progress to invasive, but it takes years for it to get converted into invasive cancer. So this period is available for the doctor to treat, manage, and control the initial stages or changes of cervical cancer pathology, and so that the women doesn't develop a full-blown stage 2 or a stage 3 when the prognosis is not too good. The other prevention way is by vaccine. As you all are aware, these days vaccine are there and you must have heard about it. So good part is for cervical cancer also we have a vaccine. Now, as HPV is a DNA virus. Now, this vaccine is also based on this DNA recombinant technology. And two types of cervical vaccine are available in India. The trade names are one is Gardasil and the other one is Cervarix. These are the two commercial names which are available. Gardasil is a quadrivalent vaccine and a Cervarix is a bivalent vaccine. Both are equally effective against cervical cancer. The good part is Gardasil protects against genital warts also. So, if you want a protection against genital warts and the cervical vaccine, then usually we recommend Gardasil. So, in young patients, uh, usually Gardasil is given because it acts against both the prevention of both of the things, HPV and genital warts also. Whereas Cervarix is mainly against cervical cancer. And the genotypes like 16, 18, and the various other genotypes which are carcinogenic, the vaccine acts against all these variants. Now, the dosage of the vaccine is for Gardasil, it is the first dose, then after 2 months, the second dose, and after 6 months, the third dose. Now, three-dose recommendation is for women in the age group of 25 or 20 and above. Okay, so we usually recommend 3 doses. Whereas in Cervarix, the dosage schedule is slightly different. It is first dose, and the second dose is to be given at 1 month, and then the third dose at 6 months. So both the vaccines require 3 doses, and both are equally effective. Whichever is available, you can, and if you have a choice, you can, choose Gardasil because it protects against the genital warts also. So otherwise, as far as cancer is concerned, both are equally effective. And normally, the gap between the second and the third dose should be at least 12 weeks. And in case due to some reason you forget to take, you've taken 1 dose and then you forget to take the second dose, or you're not able to take the second dose, whenever you remember, whenever you visit the doctor, the dose can be picked up from there. You don't need to restart the whole schedule again. You can just take your pending second or the third dose, whichever is remaining on the vaccine this thing. And now, as I said, the cervical cancer is uh, happens only in sexually active women. So ideally, the cervical vaccine should be given to all the young girls before they become sexually active. So now it should be included in the part of the pediatric vaccination schedule. So young girls of 14, 16, or anybody age of 12 should be offered cervical vaccine in order to prevent cervical cancer in later stages of life. Usually, according to the Indian Association of Pediatrics, they recommend 2 doses of Gardasil in a younger lot, with say 12 years and above. The first dose, and after 2 months, the second dose. So Gardasil because it prevents against genital warts also. So in a younger or a young girls, I would say 2 doses are recommended. And this can be followed up 6 years later by another booster dose. So, ideally, all young girls before they become sexually active should be vaccinated by this vaccine. But still, if it has not happened, every woman or any women at whatever age can go for it. It is not that, if you've not received by 14, 16, or 18 years, you can't take it at 20 or 25 or 30. You can take the vaccine, irrespective of whether you have HPV infection or you don't have HPV infection. You can take the cervical vaccine at any stage. Well, pregnant ladies, pregnant ladies shouldn't take the vaccine. In pregnancy, we don't give this vaccine. So that's the only contraindication. Side effects are not too many. Those are minor side effects like pain during the on the injection site, slight fever, local tenderness. So it's a pretty safe vaccine with almost negligible side effect. So ideally, all women should take the vaccine. It's cervical cancer is a preventive cancer. We can easily detect, prevent this cancer, and all the women should ideally go through a Pap smear and a cervical cancer when as and when required. Thank you. Any questions? Then I will just answer your questions. So there are no questions as of now. Yeah, I think we can close the session if there are no questions and queries.
Okay, doctor, since there are no questions, I guess it's best if we end the session. It was really nice having you, and it was a really informative session. Thank you so much for the education. We appreciate it.
Thank you.
Thank you, everyone, for joining, and we'll see you next time.
Thanks.